Welcome to a special State of the School edition of Maryland Medicine Frontline News. In the next few minutes, we'll look back at 2020, highlighting our response to the COVID-19 pandemic and our many positive achievements. But first, a message from Dean Reese.
Thank you, Larry. I'd like to welcome everyone to this special State of the School edition of Frontline News. I'm pleased to report that despite the extraordinary challenges of the COVID-19 pandemic during the academic year, the School of Medicine continued on its path of growth and success in each of our core mission areas: research, education, clinical care, and community impact. That success can be attributed to the hard work and dedication of each of you, faculty, staff, students, trainees, alumni, Board of Visitors members, and all of our partners at the University of Maryland, Baltimore, and the University of Maryland Medical System and Medical Center. I'm also grateful for the support we received from our donors, the Maryland Legislature, the University System of Maryland, and the Governor's Office. It has been truly gratifying to see how we have come together as a community during this challenging time. That relentless spirit is part of who we are. It is part of our DNA. We're known for taking on the toughest challenges, the most complex diseases, and the most urgent cases. Over the past year, we have shown our true leadership during the pandemic through our Instant Command System, our vaccine development and therapeutics, and our large COVID-19 high-throughput testing program for the state of Maryland. At the same time, we moved forward to record levels of research funding. We launched our new Renaissance curriculum and made significant progress in our culture transformation initiative. As you know, the pandemic continues, and we're not yet out of the woods. We must remain vigilant. I am confident that if we continue to focus on our path forward, we'll be able to recover and transition back smoothly as soon as we're able to. Again, my sincere thanks and appreciation to each one of you. Please enjoy these highlights from the academic year 2020.
Unfortunately, the pandemic prevents us from gathering in Leadership Hall as we normally do. But as you know, 2020 was far from normal. The year was dominated by the challenges presented by the pandemic. But the School of Medicine responded in stellar fashion, and we advanced in all mission areas. In response to the pandemic, researchers quickly applied for $193 million in COVID funding, with $32 million awarded, including important grants to support emergency vaccine research. In 2020, the STRAP program came to a highly successful conclusion, with the recruitment of 25 preeminent NIH-funded scientists. STRAP researchers alone brought in more than $100 million in grant funding, further elevating our national and international research profile. As a result, grants and contracts rose 4% this year to a new high of $563 million, representing a 41% increase since 2016. The School of Medicine now ranks 7th in total grants and contracts among all public medical schools. Despite a pandemic lockdown limiting healthcare delivery, clinical revenue was also strong, with $351 million in practice plan income, reflecting an overall increase of 20% over the last 5 years. And in philanthropy, the School of Medicine concluded FY 2020 with gifts of $54 million. The Bill and Melinda Gates Foundation was the top donor, giving $16 million to sponsored research. Culture transformation remained a top priority in 2020. This year, we created equity in promotion for non-tenure track faculty, completed a faculty equity compensation study, developed a new diversity dashboard, and finalized a diversity faculty recruitment policy. All of these accomplishments occurred in a year that began amid fear and uncertainty. In January, vague warnings about an outbreak in China soon became a chilling reality around the world as we began to see images of the sick and dying. And by March, the governor of Maryland declared a state of emergency.
We are no longer asking or suggesting that Marylanders stay home. We are directing them to do so.
At the University of Maryland, doctors and nurses on the front lines worked tirelessly to save lives and protect themselves from a virus that was not fully understood. Meanwhile, School of Medicine vaccinologists and scientists began a race against time to discover vaccines and therapies. At the R. Adams Cowley Shock Trauma Center, a COVID-19 intensive care unit was established to treat the unusual life-threatening symptoms and protect frontline caregivers from infection. Personal protective equipment is checked and double-checked before caregivers enter the hot zone.
So you go through the first airlock, and you're out of the cold zone into the warm zone. They close the first door behind you, and it's like something out of a science fiction movie. You go through one door, the door closes, there's a definite change in atmosphere, and you go through the next door, and now you've entered into the hot zone, and that's where everything is presumed to be contaminated by COVID because it's all one large shared airspace. Everyone in there is profoundly critically ill. A lot of them have multiple organs that are failing or have failed. People feel very short of breath.
The sickest patients are often placed on ventilators for long periods of time, as survivor Lou Packett remembers.
I was on the ventilator for 3 weeks. When it attacks you the way it attacked me, it's no joke.
Frank Rotundo was treated by Dr. Carl Shanholtz during the darkest days of the pandemic. Like thousands of others, Frank is lucky to be alive.
He really cheated the odds and is recovering very well.
The pandemic also took an emotional toll on frontline caregivers, especially young residents.
The hardest parts for me have been when someone has expired and I've had to call their family member and tell them that they cannot come into the hospital to see their loved one. Or when their loved one is ill, but not critically ill and not dying, and saying that we're here taking good care of them. We'll try to get you a FaceTime set up, but no, you cannot come in to see your loved one. Saying that over and over again, every time a trauma comes in, is a little knife that goes through my heart, and that part has been very devastating. I've just never had to experience something like this.
What's been the most surprising thing about the severity of COVID-19 to you?
It's in the way it's impacted all of us and our loneliness and who we are as humans.
Throughout the crisis, Dr. David Marcosi and Dr. Wilbur Chen served as advisors to the governor on the response. In fact, the University of Maryland began preparing for the pandemic long before the first case was ever reported in the state, establishing a special preparedness task force with representatives from the School of Medicine, the University of Maryland Medical System, and the University of Maryland, Baltimore. Telemedicine has played a vital role in that response, with special robots protecting patients and caregivers.
If the patient can converse, I talk to them. I always introduce myself. I'm Dr. Reynolds. I'm one of your critical care doctors here. How you doing today?
From his desktop, Dr. Reynolds can monitor vital signs, access patient records, and consult with colleagues.
It's no different than when I'm there physically versus virtually.
As doctors fought to keep the most critically ill patients alive, School of Medicine vaccinologists at the Center for Vaccine Development and Global Health and the Institute of Human Virology worked at warp speed to investigate vaccines. The most promising candidates trick the immune system into generating antibodies.
This particular vaccine, an mRNA vaccine, actually uses the genetic code.
Clinical trials are well underway, with participants from all walks of life, including School of Medicine Board of Visitors member Michael Greenebaum.
I really believe in research, and I'm happy to do my part and hopefully encourage others to do their part as well.
Both my parents are in the low end of the high-risk age group. I recognize on a personal level and on a community level just the urgency that there is to move these vaccines forward.
At the IHV, a novel approach to the quest for a vaccine is being explored by Dr. Robert Gallo, who believes a live oral polio vaccine might stimulate the innate immune system to fight the coronavirus.
That's our emergency response. It reacts immediately. It's like the first responders in a disease clinically.
School of Medicine scientists are testing new treatments to ease the symptoms of COVID-19. For example, the School of Medicine conducted clinical trials to show that remdesivir is an effective treatment.
It's an intravenous drug, and so it's given to people who are hospitalized with COVID. And the way it works is that when the virus gets into human cells, it clones itself, it replicates.
Dr. Matt Freeman, one of the world's foremost experts on coronavirus, is testing hundreds of drug therapies using organ-on-a-chip technology.
We can then look at the host factors that are involved with the infection and how the drugs are affecting that response. We have basically human lung epithelial cells that differentiate on this little chip.
The School of Medicine has also played a key role in testing throughout the state.
We are very far along on an ambitious and far-reaching partnership that I announced in April with the University of Maryland, Baltimore School of Medicine.
Under the leadership of Dr. Sandy Stass and Dr. Claire Frazier, the school implemented high-throughput COVID testing.
We've performed over 225,000 tests.
So that's a lot of testing with a quick turnaround time. So we're providing accurate and timely results to the residents of Maryland.
Looking at any metrics, this operation has been very successful.
Despite the pandemic, the School of Medicine continued to educate students while launching a new Renaissance curriculum. The entire curriculum was moved online, and 39 courses were developed, including a class on COVID-19. We found new ways to celebrate milestones like graduation and match day. For the first time in history, these events were held online. More progress was made in the school's Culture Transformation Initiative.
We all have biases. Let's recognize we have them and accept it.
Key appointments throughout the School of Medicine will ensure continued focus on diversity and inclusion in clinical, research, and educational programs. And a new conflict of interest program was established, co-led by Dr. Terry Rogers and Dr. Joni Prasad. In Community Impact, the Department of Family and Community Medicine is communicating important infection prevention information in West Baltimore, gathering vital data about health disparities, and improving the delivery of primary care.
We wanted to know within their community how much of the virus was there. We wanted to know also about their specific needs that could impact their health.
Student volunteers made a difference in the hospital and in Baltimore neighborhoods, promoting testing and prevention.
This has been really illustrative as far as what a robust public health response looks like, and their willingness to involve students, I think, is commendable as well.
And despite the pandemic, Mini Med School continued online this year, expanding its audience from West Baltimore to the West Coast. The virtual Mini Med School for Kids attracted more than 200 online participants from all across the country.
We didn't know what to expect. This is our first time doing it all virtual, and so we were keeping our fingers crossed that we would get campers, and the response was overwhelming.
There are many reasons to be hopeful and thankful that so many people have recovered from COVID-19 because of the efforts of our frontline care providers and scientists and the thousands of people behind the scenes who've been working day and night to treat the sick, to develop vaccines, and test new treatments. But the fight is not over. That's why it's more important than ever to support the faculty, physicians, and scientists of the University of Maryland School of Medicine until the fight against COVID-19 is won. Thank you for joining us online for the State of the School, presented as a special edition of Frontline News. Next year, we hope to see you in person for the State of the School when we return to Leadership Hall.